1.5 hours was very less. From 4:30 to 6:30, 2 hours if I don't practice yoga. So I don't say that today I have not practiced yoga. Nowadays, even if you practice 5 minutes and do 10 rounds of Anilom Viloma, so you found, yes, today I did yoga. So this is the lifestyle and this is the emerging situations. We are all aware of it. So that's why again this Ayush Ministry has come up with. It was launched by Honorable Ayush Minister on 1st September, and it is in the public domain. And why break or yoga break? So you can download it. There also we have a learning modules and also practice module, and YouTube also MDNY why yoga break. It's a wonderful app. I'm very proud that they are all of highly international standard, and we brought it from our institute. This is distress, refresh, and get refocused to enhance immunity to at their workplace. I just remember for these things, our Honorable M.A. Bole sir, who is not with us. I'm very proud he was a part of this project, and Sridharanji and myself did a lot of work for 2 years. And we found that to minimize the discomfort throughout the day, increase the productivity of individuals at workplace. Wherever we introduce the corporates, they try to continue that one. So like this, before I thank, I put up these 2 apps. Like, why I'm putting these 2 at the end? There are technologies now, the realities. So in the management of PCOS also, we can use the technologies and apps and simple modifications. Not only conducting these seminars, etc. This one part, but whenever we conduct such seminars, we have to come up with one. After this, we have to come up with small resolution and a package, a capsule, and if possible, make it a app type of thing, and videography. It hardly cost 1 or 2 lakh rupees or 3 lakh rupees. So put it in the public domain, and that will be very useful and very meaningful conducting such a webinars, because many of the experts are floating their thoughts. So once we concretize that one, that will be help for the entire human population. With these few words, once again, I wish webinar all the success, and once again, thank you, madam, and all the organizers and the experts. Jai Hind, Jai Bharat. Om Shanti Shanti Shanti.
Excellent presentation, sir. And you really, gave everything in a capsule form, as you were saying again and again. So many points are so, potent, so that we can pick up some of them and we can develop on that. Thanks a lot. Thank you very much.
Yeah. Thanks for your time and an excellent talk. Thank you so much.
Dr. Geeta, madam, are you there?
Virja, just wait. We are looking forward for chairperson and co-chairperson's remarks. Dr. Geeta, madam, I can't see her. So Dr. Ashish Farke, sir, you can share your remarks about the inaugural session.
I think it was a very wonderful and very learning experience to have all these learned speakers. And I'm sure without wasting much of the time, because we are running short of time, I suppose,
Absolutely.
We will go ahead with our next session, wherein we will be getting many more things. So I thank you once again to my own mother institute, KIHS-MRF and NIRH, for giving me opportunity to be with all of you. I thanks all the speakers. I thank my co-chairperson, and I think we should go ahead with. Thank you. Thank you very much.
Yeah. Thanks, everybody.
Thank you very much. It was a great inaugural session. Thank you, madam. Now I hand over to my co-convener, Dr. Vibhuti Rao, to take over for the second session. Vibhuti, over to you.
Thank you, madam. I welcome you all for the second session for today's event. And we have, on this occasion, it gives me a great pleasure to introduce the chairperson for the next session. We have 2 great scholars and eminent practitioners from medical and yoga field. First of all, we have Dr. Satish Pathak. Dr. Satish Pathak is a recipient of various awards, such as Yoga Ratna Award, and has published various papers in eminent journals. He is very well known for his work in Yogic Kriya and Asanas. Currently, he is Assistant Director and Scientific Research Department, Kaivalya Dham, Associate Professor in College of Yoga, Kaivalya Dham, Vice Chairman of Indian Yoga Association, and member Scientific Advisory Committee at Ministry of Ayush, Government of India. So we have our second chairperson today, Dr. Neeta Dalal, a very well-known gynecologist from Saifi Hospital and Breach Candy Hospital. She's a consultant there, and she also have a huge list of achievements and awards. To brief some, I have listed here. She's an ex-associate professor at LTMG Hospital and LTM Medical College, president of Mumbai Menopause Society and a committee member of Abhiyan PCOS India. And she has special interest in menopause and PCOS. I welcome you both, eminent chairpersons, for today's event. Thank you so much for gracing this occasion. I hand over to you, Dr. Satish Pathak and Dr. Neeta Dalal, to introduce the speakers and taking over the session, please.
Unmute yourself.
Thank you very much, Dr. Vibhuti Rao. I request to put the slide of Dr. Nidhi so that I will introduce her. The first speaker in this international webinar on Intersystem Dialogue on PCOS, Dr. Nidhi Choudhari. I am happy to introduce her. She has done PhD in yoga, and she is yoga consultant at Suruda Clinic, Bangalore, India, and also a yoga researcher. She is CEO of Yoga Plus India, Bangalore. She is also director for Yoga Fame Buddy Private Limited, Bangalore, and she is also academic director of Adhyatma Yoga, Bangalore, India. She has got a lot of achievements. She is a yoga practitioner for more than 2 decades and has studied from Iyengar Yoga School. She has guided doctorate students for projects such as yoga for obesity, cardiac rehabilitation after myocardial infarction, allergic rhinitis, and acupressure with yoga for common elements. She is international. She has toured internationally at USA and Singapore for conducting yoga therapy workshops. She has presented her work at several international conferences like International Conference on Traditional and Alternative Medicine and the Congress for International Diabetic Federation. She has received integrative medicine program and research training from MD Anderson Cancer Center, Houston, Texas. Dr. Nidhi was instrumental in planning and execution of the first International Yoga Day with Government of India. With that introduction, I invite Dr. Nidhi Ram to talk on yoga management of PCOS. Thank you very much, madam.
Thank you, Dr. Satish Pathak. I would like to share my presentation. Okay. So my talk would, I guess, would continue from where Dr. Rama Vaidya left. And she has emphasized the importance of imbalance between the sympathetic and parasympathetic component of the body. And probably that would be the cause for PCOS, or is it a like symptom or after effect of PCOS, is where she left. And I would like to continue from there, bringing in the yogic understanding of a disease and yogic approach to the healing. We all know the PCOS, how it happens, and there are a lot of side effects which the person suffers with. Some of them are physical, but there's a lot of psychological component to it. The person suffers with anxiety, low quality of life, depression, distress, and as my research was with the adolescent age group, I saw a lot of body image anxiety and depression associated with the symptoms like acne, hirsutism, hair fall, and that creates a lot of social dysfunction in their life. What is the cause of PCOS and how do we look at it? Please.
Dr. Nidhi, you want to share your slides?
Full screen.
Full screen, share your slides.
Full screen.
They have.
Yeah, now it's there. Thank you. Thank you.
You have to put it in a slideshow mode.
Full screen.
Okay.
Yeah, that's the button where you were clicking. Right. Yeah.
Madam, namaste. Shall I take a leave if you are permitted?
Please,
Madam?
thank you very much for joining us. Thank you very much.
Yeah, thanks for your presence.
Thank you, sir. Thank you.
Nidhi ma'am, you can click on that icon. You had just gone there.
Sorry?
You have to put on a slideshow pattern.
I did that.
No, you will have to reshare your screen, entire screen, not just the application.
Okay, let me come 1 second.
You can stop sharing and reshare it if you are having any problem.
Yeah. Okay. Is this okay?
Yeah, now we can see full screen. Thank you.
Thank you. So how do we see the PCOS and what is the cause for it? So obviously the research is able to figure out that there are some genetic factors, there are some genes, family history where the girls in the next generation are more prone to develop PCOS. But there is a lot to do with the lifestyle. And as Dr. Ishwar Basavaraddi was saying, that whenever we talk about lifestyle, it doesn't mean only exercise or only trying to lose weight. There are 3 parts to it. It includes having an active lifestyle and not be sedentary, eating right. The diet also is one part of the lifestyle. And third is the stress management. How are you able to manage your mind? How is your thoughts, emotions affecting your day-to-day functioning? So all the 3 together come when we talk about lifestyle, and we are seeing that there are a lot of girls, young girls, adult women who are struggling with all these 3 areas. Sedentary lifestyle, low activity, low exercise, wrong eating habits, and sadly no training in our education system to teach us how to manage our mind and emotion, how to deal with the stressful situations without letting it affect our health. And the management of PCOS, as we all know, it is stuck on metformin as one of the insulin sensitization medication. There's a lot of research done in the field of diet about how we can lose weight through different ways of dieting. There's a lot of research done even in the exercise area, where fat burning, aerobic exercises. Recent research has shown that actually too much high intensity exercise also can be damaging and may not help the patient as much as compared to the research which was 15 years back talking about a lot of high intensity exercise for losing the weight. Sorry, 1 second. Now, this is one of the most important slide of my presentation, and this is the basis for the whole yoga therapy for PCOS. how do we look at a disease? How do we look at a person who is getting affected by some medical condition or disease? So the Taittiriya Upanishad has given us a concept called Panchakosha Viveka, where it explains that a living being or a human being is not just what we see as the body, which is known as the Annamaya Kosha, the physical body, what we see outside. There is something subtle and beyond the physical body, which is like the Pranamaya Kosha, the life force, what we breathe in, what keeps us alive. Third one is the Manomaya Kosha, the mind, where we feel things, our emotions, our feelings. The fourth one is Vijnanamaya Kosha, in the sheath of our intellect, the capacity to judge between right and wrong, the intellectual capacity to be differentiating between right and wrong. And the final sheath is the Anandamaya Kosha, which is the layer of bliss. And that is kind of the goal of our yoga therapy. We try to correct at physical level, then we try to correct at life force level or prana level, then we try to correct at manas level, we try to correct the notions for the person to try to bring them into the layer of bliss, to the layer of ananda. And if once they establish themselves into that ananda level, that is where you will achieve the maximum health. And health is not something like how most of us understand the absence of disease or the absence of pain or the absence of discomfort. It is way beyond that. Positive health and peace of mind and being able to exist in constant happiness and bliss and not able to divert from there. So that is like more and more going from gross to the subtle, using your awareness, having to gain the control or mastery over your awareness through simple practices of asanas, pranayama, meditation, and then use that awareness to reach to that ananda and try to establish ourselves there. Etiology of disease from different yogic texts. A lot of yoga texts which talks about the core of a disease development actually starts at our manomaya kosha, at our mind level. So Patanjali has given it in Patanjali Yoga Sutras as kleshas. There are 5 kleshas: avidya, asmita, raga, dvesha, abhinivesha. Literal translation can be avidya is ignorance, asmita is ego, ragas are attachment, dveshas is hatred, and abhinivesha can be fear of unknown or uncertainties. So these are the 5 kleshas which can cause a person to reach dukkhas or constant psychological distress and misery. Krishna has given another definition similar to this in Bhagavad Gita. Shri Krishna has told it in one of the sutras or one of the mantras, very beautifully explained. Dhyayato vishyan punsa sankastesho pajayate sanjat sanjayate kamaha kamat krodho vijayate krodhat bhavati sammohaha sammohat smriti vishwamaha with sammohat smriti vibramaha
Smriti Bhramshat Buddhi Nashat
Pranashyati. Thank you so much, Doctor. So it explains that how the attachment to one wrong thought, there is a pathway. He has clearly given a flow chart, a pathway of how attachment to a wrong thought can lead to the destruction of a person itself. And this is what is the concept of disease from Bhagavad Gita. Yoga Vashishta, a third text, has clearly mentioned in a very simple term for all of us that Adija Vyadhis means The adhis, the mental disturbance or the disturbance at the mind level actually leads to the vyadhis in the body. So it comes to the disease in the body or physical discomfort at the body level. So all the yogic texts have clearly told us that it all starts from mind, and then it percolates down to the prana, then it percolates down to the body level. And we see it at body level as the symptoms and discomforts eventually. But if we want to cure or if we want to reverse the condition, we have to go to the cause, we have to go to the core, which is the mind. If we are trying to correct the mind, then we would see that, okay, when the person is calm, when the person is relaxed, when their stress levels are low, when their cortisol levels are low, and they come to a much balanced homeostatic state of their being, then all the hormonal issues, they kind of reverse, and you would be able to see the correction happening in all the symptoms, all the conditions what we see. This is one of the etiology and yoga mechanism chart which I had prepared during my PhD, and I really would like to, I think this is what would help us to understand how the yoga helps PCOS. So I would like you to see the second half of the chart, because that is what you already must be aware of. The imbalance at HPO axis, hypothalamus pituitary ovarian axis, or the imbalance at HPA axis, hypothalamus pituitary adrenal axis, which leads to so many diseases and comorbidities which are associated with PCOS. And I know you all are aware of it and thoroughly researched about it. How yoga helps? Yoga brings about 3 effects, which are, it has one simpler exercise effect, which we all are aware of. When you stretch, when you do any form of exercise, it helps increase your metabolism and would probably help with obesity and all the metabolic disorders. The second effect is the rest effect of yoga. If I'm probably not able to bend, stretch, or do as much as shown in the yoga images, bending, twisting, and turning upside down. If I'm a person with so much comorbidity that I cannot do all of that, and probably I can just sit and focus on my breathing, I can work on my mind, I can do simple pranayama, relaxation, and some gentle movement, still I would be having a great benefit through the rest effect which I gain from practice of yoga, which helps in reducing the sympathetic activity in our body, which can help in correction in a lot of comorbidities which happens with these conditions. And then third is the balance effect which comes with yoga, which helps in correcting the hormones, the release of the hormones from our body through HPA or HPO axis. But what do we mean when we say that this rest effect or balance effect, or how do I do this correction at our mind level? What exactly yoga brings to the table when I say we need to reduce the stress, we need to correct notions, and we need to bring the person to the perfect health? What is it that yoga helps us there? So in a normal case where a person experiences a demanding situation, they develop a perception to the situation through the help of cortices, and then based on that perception, there will be some limbic cortex part of the brain would be getting the person into this intrusive repetitive speed. Let me give you an example. Like I'm sitting by here around my table and working on my computer. I see something moving by the window. I perceive it to be, maybe it's a snake. Maybe it looks like something creeping, crawling around there. And I developed that intrusive repetitive speed inside my mind that, okay, there's a snake, it can be dangerous, it is going to come in, it is going to harm me. And I start getting that rush and the stress developing in my body. In response to this, there'll be an uncontrolled response which my body will create, which can be either if I'm perceiving something exciting, then I might show positive emotions of excitement and hypomania. Or if I'm perceiving something as negative, I may show anxiety, fear, depression, lethargy, no movement or something. In both the cases, whether it is a suppression or expression, it is happening through the lower part of my brain without any control. And that is what is unhealthy and experienced by most of the people we meet today. How does the yoga help? If I'm not sure if you have gone through the research done in the field of yoga. A lot of research is done on meditators and siddhas and great yogis, and they have seen that people who have been meditating or who have been doing yoga for years or great yogis, they have a very active prefrontal cortex. They have actually showing the growth in the prefrontal cortex. And that is the part of the brain which is going to help us bringing this mastery, mindful mastery over our responses. We avoid the repetitive speed. It slows down our mind, slows down our reactions, and develop a voluntary control over whether I choose to respond negatively or positively. But it will be well under control without leading to the physiological changes which comes with the uncontrolled response when I show on my body. So this is where the yoga helps at the mind level. And then at a physical body level, yes, we stretch, we exercise, we try to work with our prana, we try to correct our imbalances in our nadi, we try to have a better flow of prana in the body, and relax, be calm, be positive, and try to work with our notions and mind to actually not develop these kind of uncontrolled responses. Why am I presenting this article or paper here? Because it really helps my talk. A lot of people today says that when I teach patients, when I teach a lot of even yoga teachers, and I ask them, do you think you are stressed? Do you think, how many of you think you are under stress? Many of them doesn't even recognize that they are under stress. They don't even believe that the pace and the speed at which they are functioning, that is unhealthy. And they try to believe, because this has been the training from the childhood probably, and people have gotten so used to of it that now everybody or the next generation or the generation which are coming up now thinks that it's quite normal to be constantly stressed, to be constantly sleep deprived, to be constantly trying to push your brain harder and harder. So there was this study where they tried to study athletes, and they have made one group of athletes, ask them that, okay, you run, and they have the researchers have studied the FNI. Sorry, is anybody
can I interrupt? We are running very late, so is it possible for you to wind up, please?
Sure. So this is the integrated approach of yoga therapy that we taught to the women in our study. We have given them Surya Namaskara and a wide range of asanas, and closed with the breathing techniques, pranayamas, and relaxation, a short Om meditation, which was taught to the women in the study. How do it helps? At physical level, we try to improve the blood circulation to the uterus and ovary and improve the apana prana circulation, if you are aware of panch pranas. At pranamaya kosha level, we try to release the toxin, detox the body through a better oxygenation. At manomaya kosha level, we try to calm down the mind, reduce the stress effect in the body, reduce the cortisol levels, and improve the immune functions of the body. At Vijnanamaya Kosha intellectual level, we try to do the notion corrections through lectures and counseling. And finally, Anandamaya Kosha level, or the layer of bliss, we see that once the person is here, there is a significant increase in their serotonin levels and a decrease in their cortisol levels, which helps in recovery and healing of the person. Effects observed with our yoga study, that we saw that when the patients practice 3 months of yoga practice every day, there was lower LH-FSH ratio, lower testosterone, anti-Mullerian hormones, and insulin resistance. There was improved menstrual frequency, regular menstrual cycles. There was a lower trait anxiety, higher positive and lower negative effect. There was a lower perceived distress, and overall their quality of life improved after the 3 months of yoga practice. These are some of the publications out of that randomized control trial, which happened a few years back. I would like to end here. Thank you so much for the time.
Thank you very much, madam. I know it is very vast topic, difficult to cover in 10 minutes, but because of the time, we have to restrict ourselves. Anyway, you have heard quite a bit of etiology and pathology from allopathic point of view, also from text from Patanjali and Krishna and Vasishtha, and also you have talked on yogic management. Thank you very much, madam. I request my co-chairman, Dr. Nidhi Choudhari, to introduce the next speaker. And also, I would like to request the speakers to abide with the time of 10 minutes. Thank you.
I would like to introduce Dr. Vibhuti Rao. She is our next speaker. She is a PhD scholar from NICM, Western Sydney University, and has one of the early PhD works on Ayurveda and yoga in PCOS in Australia. She has been a university topper and gold medalist in Ayurveda academics during her undergraduate days. And she has published works on the role of Ayurveda and yoga in PCOS. And she has received many academic awards during her undergraduate days. Like a clinician like me, we would like to know what is the evidence behind what is being said about yoga. And I'm very happy that she today is speaking on an evidence review on yoga interactions in PCOS. Dr. Vibhuti Rao, please can you stick to time? Thank you very much.
Thank you, Dr. Nidhi. And thank you everyone for sticking so long to listen to my presentation. It's a great honor to be here on this occasion, and I start my presentation. The current evidence review. This will be a little bit of critical analysis, so I would need your attention, and then your remarks, your chairperson's remarks would be very helpful for us to frame this future evidence on yoga. Well, why are we meeting today? Like, why it is such an important topic today is I think very well everybody knows that PCOS is a very complex syndrome. I highlight here a very important thing, which is a social syndrome. I think we know it is physical, sexual, psychological, but it's also a social syndrome. There is a lot of stigma associated with PCOS in societies, and especially if you come from a particular cultural background, it's very profound. And in India or in other countries, we do have plural systems of medicines where alongside the conventional medicines, we do have other systems of medicine. Could be traditional systems of medicine such as Ayurveda, yoga. They are practiced in their countries, and consumers do, or the patients with PCOS or women with PCOS do approach such practitioners to relieve their symptoms. Yoga is considered as a mind-body therapy. It is an emerging lifestyle treatment method and has demonstrated promising results in managing various chronic health conditions. And there is a paper which has analyzed that yoga is not just an exercise, but it has multi-dimensional aspect to it. Yoga could be an effective, affordable option for women with PCOS to manage their symptoms at different stages of their life. The study comparing the effects of yoga and exercise seems to indicate that in both healthy and diseased population, yoga may be as effective or better than exercise at improving a variety of health-related outcome measures. This is just a slide to summarize that we have yoga practice. When we call about yoga, it is not just asanas or a particular technique. It's like a holistic approach which we are providing to women with PCOS, which may have postures, asanas, different breathing techniques, relaxation, and meditation, which could be a part of a fitness, self-regulation, awareness, and spirituality as well. So many women with PCOS come to yoga for different purposes, but at the end of the day, we have improved global functionality. And that's the whole purpose of yoga. So where does the yoga sit? We had in 2018 international evidence-based guidelines from Monash University, and they suggested that lifestyle is the first line of treatment for women with PCOS. And there was a term called yogic gymnastic. This was the word used actually, yogic gymnastic. They didn't highlight it just the whole purpose of yoga in that, but yogic gymnastic was suggested as a moderate intensity exercise for women with PCOS. And as Dr. Rama Vaidya started the topic very nicely, that is it a lifestyle? Are we suggesting women with PCOS as a lifestyle tool, or is it like a main stand-alone treatment method? So there is a lot to come yet from as per the evidence says. So what could be an effective lifestyle intervention to manage PCOS? And here we are, lifelong. It has to be, we know that PCOS is a lifelong condition, start from the womb and even beyond menopause, it continues. And there's a lot of psychosocial aspect to it. So we need something lifestyle which is structured. So you give them something structured, do this for this much time, and it is, it's going to help you in that way. It should be professionally supported. So that's very important that a multidisciplinary team who is treating a woman with PCOS are all on the same page regarding any treatment a woman with PCOS is adopting to. It should be cost effective, because when we are looking at a lifelong intervention, then cost is very important, that women can do it at their home and their time, whenever it is, they are free to do it. So it's cost effective is very important. Easy, it should be easy. It should not be a complex intervention that they find it hard to do it. Interesting, and that's very important thing, that we make an intervention very interesting for them. Suitable. So if you go somewhere and they never heard of yoga before, then it becomes a little difficult to convince a particular group of women that do yoga and it's going to help you. And that's when they come forward and ask, what's the evidence? So this is all about that. What's the evidence of yoga in PCOS? And finally, it has to be effective. If it is not effective, people won't do it. Is yoga beneficial for women with PCOS? So is it effective? If we look at how yoga is approached in PCOS, is first of all prevention. So there are a few studies, actually only one study, which has looked at as a preventive aspect of yoga to reduce the risk of developing PCOS in young girls, adolescent girls. And third one, managing the symptoms. So first of all, you prevent. Okay, you start with menarche and you start having irregular cycles. Then you advocate that, okay, start yoga exercises or yoga asanas or whatever yoga therapy it is there. And so we prevent, we reduce the risk, and we manage the symptoms if at all a woman is diagnosed with PCOS. So this is one of the study, impact of yoga and exercise on polycystic ovary syndrome risk among adolescent school-going girls in South India. So this is a very recent study. Last year it was done, and they did find that yoga was able to prevent the onset of PCOS, and they categorized the onset of PCOS as mild, moderate, or severe risk. And risk was assessed on the basis of history, the medical history and family history, all that. Then yoga has also emerged as a standalone treatment. Then it is also emerging to mix with conventional treatment, and also it is emerging as to mix with other system, Ayush system. So somebody can take yoga alone, then somebody is taking yoga along with conventional medicines, and somebody is taking yoga along with Ayush system of medicines. So this is the research which is happening. This was my study which I did along with Ayurveda and yoga together. This is the study where it was done in a single round. So, and this was along with naturopathic and yogic intervention, and Dr. Ramavedya spoke about this as well. So we go to the slide. I'm just reviewing the evidence here. This is such a beautiful, just comprehensive slide here. It gives you an insight, a quick insight into what has been done since 2012 about PCOS and role of yoga in PCOS. I wouldn't go in detail too much about it because it would take a lot of time to talk about each study and what it has done. To summarize, if we just focus on these three lines here, because these are the systematic reviews, and meta-analysis was done this year by Anita et al. And they said that 12 weeks of yoga therapy may decrease menstrual irregularity, hyperandrogenism, and levels of FBS and fasting insulin and HOMA-IR. So this is just an emerging field, so evidence is just building up in this area. But it is also suggesting that it may, it's not very much proven, it may. So this lead that I'll give you another slide, which is very summarized, that yoga in PCOS, if people who are into research, they would know that it reduces anxiety levels by 24%. I'm giving you figures because people do like figures sometimes. 55 reduction in symptoms of depression, emotional well-being improves by 44%, and it lowers your free testosterone levels, 45% correction in menstrual disorders alone, and so on. Finally, this is the crux of my talk today, is about future directions. Like why we as researchers in PCOS, coming from complementary medicine background, what we are looking at, like who is suggesting or providing yoga therapy. So if I am a woman with PCOS, who do I approach that I want to do yoga? Or is it suggested by medical fraternity? Or is it suggested by a yoga therapist? Or is it suggested by Ayush practitioners? So who is suggesting, and also who is providing yoga therapy? That's very important questions when we go for research in PCOS. Second is accessibility for women with PCOS, accessibility of yoga. So generally women says, yoga is good, do yoga. And I just join, for example, if imagine I have PCOS and I just join a nearby class, yoga class, which is running by, and they are providing yoga classes, general yoga classes, not for PCOS though. And I join that class and I suddenly feel okay about it. But I think we need to be very specific that what kind of asanas, what kind of yoga therapy should be given to women with PCOS. So is yoga effective for all PCOS phenotypes? We very well know that there are certain phenotypes also associated with PCOS. So are you giving the same yoga therapy to all the women with PCOS, or it has to be divided based on their symptoms dominancy? So it's a very important question again. What kind of yoga? So when we talk about yoga, there are varieties of yoga, Raja Yoga, Hatha Yoga, and Ashtanga yogas, just the meditation, just the asanas. So what we are actually looking at, that's very important that we specify that which yoga in which PCOS phenotypes, what technique and how it works. So then we go in detail of yoga, that what technique did we use or do we use, and how does it really work with women with PCOS? And very important again, dosage. That's a very vague criteria I have come across when I reviewed the literature, that there is no specific dosage of, when we talk about an intervention, we look at dosage, like how much yoga, of how much exercise, for how many minutes, for how long duration. Is there any gap when we do asanas? Is there any gap that in terms of, is it weekly, is it bi-weekly? So more details on that. Managing withdrawals is a great challenge. So a lot of studies, they start with very high participants numbers, but they end up assessing very few because, committing yourself to something longer duration is a very difficult task. And even to manage participants for a researcher is a very huge task. Carry-on effect of yoga, and this was suggested to me by Dr. Rama Vaidya when I spoke to her about systematic reviews, that is it that people do yoga and then there is a carry-on effect over it that, that carries on and that makes a person healthy in a longer term of time, or is it the real effect of yoga? So I'm not questioning that yoga is effective, not effective. I'm just trying to understand the technique behind it and how it is helping women with, or how it can help women with PCOS. None of the studies actually, they report associated adverse events, and that's very important that we do that in future research. And we know that it is safe. Safety has to be assessed as well, that is yoga safe for women with PCOS of this particular symptoms or this particular phenotype. We know that quality of life overall improves. So that's what we need to look for, that yoga can improve the quality of life with women with PCOS. So these are just my final some questions which I would like you to go through and throw your suggestions. As a researcher, I would be very interested to get your feedback on this. And I thank everyone for giving me this opportunity to present here and talk to you about my research in yoga and PCOS. Thank you so much.
Thank you so much, Dr. Rao. That was really a very good presentation. So we have some evidence and we look forward to much more in future. Thank you. Next speaker.
Thank you very much. I will request to put the slide of Dr. Nattu. Please, yeah. I welcome Dr. Ulka Nattu. She is a practicing gynecologist. She has done MD, DGO, and she has also done advanced diploma in yoga education from ISAR certified clinical embryologist. She is a director of Nest Maternity and Surgical Hospital. She is vice president of Gantali Mitra Mandal and Yoga Prabodhini. She is president of Nana Palkar Smriti Samiti, Thane branch. She is a chairperson, Board of Studies in Yoga and Allied Sciences in Kavaladam Yoga Institute, Lonavala, and also adjunct professor at GS College of Yoga, Kavaladam. She has achievements like Indian Medical Association 25th Hour Award, pursuing and excelling in passion beyond profession in 25th hour of the day. She has awards of Woman of Substance, Yoga Mitra, Tejaswini, then Yoga Ratna Award, Navadurga, Adi Shakti Award, Lokmach Sakhi Sanman. She has been invited to Australia, USA, Dubai for giving lectures on yoga. She has got many prizes for research in yoga and obstetric and gynec in national international conferences. She has research publications on diabetes and yoga. She has written 2 books, H3 Yoga and Yoga Ankur, and many other such articles. She is a regular programmer on TV, television and radio for last 30 years on health related topics. I invite Dr. Ulka Nattu to give talk on relevance of yoga practices for PCOS. Most welcome, Dr. Nattu.
Unmute, unmute, unmute.
yeah, in a hurry, being the last speaker. And I think we are running short of time. Trust my words, I will stick to time. In sharp 10 minutes, I will try and not wind up, but try and cover all the important points in the subject. So, okay, let's.
Madam, you can find the icon below also if you are trying to make it full screen.
Yeah.
Down below that.
Next, madam, next.
Next to it. Next to it.
This is slide
Next.
reading view.
And next.
Slide.
Yeah, this one.
Okay, thanks. Yeah. So, pranam to Omkar and relevance of yogic practices in PCOD. We have heard on PCOD a lot. I'm not going to cover that at all. The important relevant points for us today were PCOS, yoga, and correlate the benefits of yogic practices for PCOS. Thanks to Dr. Rama Madam for giving us these guidelines. Is there a yogic methodology to diagnose PCOS? Can we explain the etiologic and risk factors responsible for PCOS in yogic language? Can we help reduce the process of pathogenesis by helping to reduce the risk factors, etiologic factors to prevent PCOS the yoga way? Can we reduce the risk of comorbidities? Addressing the psychosocial and psychological issues, lifestyle management, can we develop a trans system management strategy? And last, the evidence self-supported study by us at Ghantali Mitra Mandal. Do we understand PCOD better than we did 25 years ago? I don't think we understand it still. As doctors, are we doing anything? We have a major role to play to guide our adolescents. A wave in the ocean is at the cost of hollow elsewhere. This is by Swami Vivekananda. So PCOD, I think it falls in the same lines that there is some lack of something somewhere, and that is why, as a compensation, there is a tide somewhere, full tide somewhere. There is no system of diagnosis in yoga because yoga is not a strategy which was developed for treatment. So yoga is not a science of therapy. Therapy is a byproduct of yogic practices. Diagnosis of PCOD, all of us know, is by exclusion by applying Rotterdam criteria. The risk factors, all of us are very much aware of this. The universal truth is there are limitations to modern medicine. There is no universal treatment for PCOD. The treatment is symptom oriented. And other than lifestyle recommendation, patients with mild symptoms might not require any intervention. No drugs are currently approved specifically for PCOS. Targets for pharmacological treatment, we know that is for androgen excess or for oligoovulation or for maybe insulin resistance. And treatment should be chronic along with dynamic and adapted to changing circumstances and personal needs. These are guidelines by RCOG. So what is our role of our ancient wisdom? Yoga, as I just said, is not a system of therapy, but it's a method of living with sense and science. Let us spread this message that is a true message of yoga. So yoga, as the yoga lovers and practitioners believe, is an integration and harmony between the thoughts, words, and deeds, or between the head, heart, and hands. It's a value-added, enriched lifestyle. A woman's body is not only anatomical, but there is a spiritual angle to it, which was discussed earlier by Dr. Nidhi. That is Annamaya, Pranamaya, Manomaya, Vijnanamaya, and Anandamaya Kosha. I'm not discussing that in detail. What is most important is understanding, experience, and appreciation of yoga, which can convert the practice to culture. Let's not become only the true yoga practitioners for half an hour of the day. Let it get imbibed in your thoughts and behavior as a yogic culture or a yogic lifestyle. And for this, sincerity, seriousness, and commitment in the sadhana is extremely important, says Swami Niranjanananda. Yoga can help PCOD in many ways. We all know that very well by now, that better control of stress, change in the attitude because and changing food habits, correction of circadian rhythm, hormonal status, everything we know what can be achieved by yoga. But how do I do it? That is the most important question. How do I try to imbibe the principles of yoga in my personal life? I know what obesity and PCOS, the relationship. What is obesity doing to PCOS and what is obesity in PCOS resulting in? I'm not going into the details, but let us understand, if I do yogic practices with sincerity, seriousness, and commitment, it affects a lot of plethora of biologically active adipokines such as leptin, adiponectin. That is what was mentioned by Dr. Ramavaidya with tumor necrosis factor, interleukin 6. And they are known to be involved in a lot of pathological processes. There are a lot of means which a youngster knows as a fitness exercise. Now, are we doing yoga only for physical fitness? This is all the chart of fitness, where you have a lot of other modalities of exercise. But where are the yogasanas in this? They are into endurance, hygienic exercises, and that is what is yogasanas. But with yogasanas, you're not doing only physical exercise. With yogasanas, what you are trying to achieve is tato dvandvan abhigataha. That is what is the principle Patanjali has discussed. You are trying to get over the dualities in life, the stress in life. Ashtanga yoga, all the limbs helping dealing with stress. Trust my words. Yama, niyama, asana, pranayam, pratyahar, dharana, dhyan. Everything has a therapeutic angle. We have not experienced samadhi as yet, so I have not included the 8th limb of Ashtanga yoga in this. But let us understand, practicing yama is equally important. Ahimsa. If I'm angry with somebody, if I've cursed somebody early morning and I've had a fight with my husband, by no way I can practice any asana which might be helpful for me for my PCOD. Maybe if I just sit in Sukhasan and not do Sarvangasana or Viparit Karni with a totally thoughtless state of mind, that will have better benefits or effects, rather than performing difficult asanas with a disturbed state of mind. So what is most important is culturing the attitude with which you are performing any practice of Ashtanga yoga. Now, role of pineal is extremely important. I'm not going into the details, but melatonin is something which we are neglecting, which is related with the circadian rhythm. In fact, melatonin is incorporated as in the tablet forms when we are inducing ovulation. Now, this effect of melatonin on estrogen and progesterone receptors also has been studied. Now, it is proved beyond doubt that an irregular lifestyle is known to give rise to increased number of estrogen receptors on estrogen uterus, which is what is the precursor of the fibroids, the endometriosis, and the PCOD. So all this is, related to lifestyle. So let us correct the lifestyle. Now, before correcting the lifestyle, let us understand what life is. So that is what all the yogic philosophy is about. So let us try learning it from the scratch, so as to we'll be able to imbibe it in our lifestyle. The other comorbidities, they come hand in hand by default. So infertility, complications in pregnancy, diabetes, type 2 diabetes, cardiovascular risk, depression. These are all the, we don't know whether it is a result or the cause of PCOD, but that is what it is. Now, here is one project conducted by us at Gandhali Mitra Mandal. And this was the project called Swapnankur, and where we had PCOD girls who were enrolled with us for 4 months, and we conducted regular yogic practices for them. And these are some of the pictures. These are the girls who were enrolled in the study. Lot of the yogic module was applied, and including the asanas, pranayam, nada yoga, yoga nidra, everything was applied to these girls in 1 hour, 1 to 1.5 hour session every day. And I'll tell you, this research was presented in one of the national gynec conference, and it has won the first prize for the best result, for the best research in gynec. So the number of follicles, you can see the ruptured follicles, the perifollicular flow, the vascularity, the endometrial thickness, the resistive index, and the anxiety scores. They all have shown the significant p-value. Now we have another project of 85 PCOS girls who are under yoga therapy and who are under the sleep study also. We are giving them some practices which are helping them improve the quality of their sleep, improve the quality of life. So this is all, the personal experience. I can say that all the patients, whoever I come across as PCOD patients, definitely the yoga therapy module is something which is incorporated by default for all of them. We know this access from Speroff textbook of endocrinology. All the 4 compartments you can see, all asanas have a definitely the effect on the visceral decongestion. The second compartment, that is ovary, that is also benefited beautifully by practice of asana. See, by default, the correction of hormonal status is the result of the cooling down of the mind. So everything is sort of, interrelated. So ovary is benefited, anterior pituitary is benefited, the hypothalamus is benefited. Why? Because the limbic system is getting affected because of good practice of yoga. That is because of Nada yoga, pranayam, everything. So pranayam, pratyahar, dharana, dhyan, everything has an impact on hypothalamus and of course the central nervous system or the frontal lobe. So yoga has an effect on physical, mental, emotional and spiritual level. I am not going into the detail of what every practice at physical, mental, emotional, spiritual, social and dietary level is going to do, but you to trust my words blindly that it has a direct impact on all systems. So this effect of stress on HPO axis, which is showing, the target organs getting affected after the yogic practices, the arrows go up and they move towards stabilizing the mental state, a tranquil state of emotion. And yes, then you understand what is spirituality. Spirituality is, nothing, but, we start practicing all this at a later age in life, unfortunately, but it is something which an adolescent should be exposed to, because it is something which is, the hidden meaning of it is introspection. What is the point of introspection at the age of above 60? You must teach the child to introspect, to minimize the errors in life when the child is young. So integration is key to success. The only certainty that works in human body is uncertainty. Modern medicine just tries to predict the unpredictable. So we have to incorporate the other modalities to reach the root cause of the problem and eradicate it completely. Let us not have tall claims that we allopaths only have the best in this world. As Ayurvedic physicians, let us not claim that our science is old and ancient and we give the best. Let us have the combination of everything, the beautifulest of the beautiful thing from every faculty of medicine, from yoga. I'm not putting yoga in the therapy category, but when we combine all this, we can give the best to the world, to all our youngsters. This is a famous poem by Rabindranath Tagore. If I can't make it through one door, I will go through another door, or I will make a door. Something terrific will come, no matter how dark the present. I think it holds true for PCOS. I thank you all for the patient hearing. I know I was the last speaker, but still, thanks a lot for waiting till I finish. And once again, thank you, Rama Madam. Thank you everyone for giving me this wonderful opportunity to share my views and thoughts with you all. Thank you.
Excellent, excellent.
Thank you very much, madam. You tried to abide with the time and you have tried to cover most of the points in that 10 minutes. And also one important message, which I would like to tell in my comments. But before that, I would request my co-chairman to put their remarks. Then I will give my remarks. Thank you very much.
I think that this second session has been excellent. And for a clinician like me, who's purely allopathic and who has more questions than answers, what is the evidence? How much does this work? I think this conference has gone a long way in telling me a lot of what can be done if all the different systems of medicine come together. It's a much better outcome than only if we blindly stick to one system of medicine. I think those are my remarks.
Okay, thank you very much, madam. Giving concluding remarks, most of the speakers, they have covered very beautifully the etiology, pathology, then how we can do with that, and how yoga can help, and how the yogic practices can also have effect at different levels. I would like to congratulate all the three speakers for giving very beautiful narration of the PCOS and how we can help people to get rid of the PCOS. I would like to thank and special mention to Dr. Nathu's comment that keep our ego away. It's not that every pathy has got its own limitations, and every pathy has got something good. So let us take everything good from all the pathies and treat the PCOS patient who are suffering. Now, I would like to add one more thing. As we have gone into details that PCOS is it is more psychosomatic, acting at mind as well as the physical level. So yoga has got a holistic approach. So if I want to talk on yoga, I will say that it should be used not as a, I have done yoga for PCOS because Dr. Pathak has told or Dr. Nathu has told, so 1 hour I do it and forget about it. It should not be. It should be a yogic style, lifestyle. So imbibe yoga. So I would request that we should make a statement, or we should run after that, that we should use yoga as a preventive, curative, and adjuvant. So preventive will be targeting the school children when they are still not exposed to the new lifestyle and new amenities. So there and there only you can curb their habits, and that will be better so that they will not develop PCOS in their adolescent life. So, and for developing the interest into the yoga to the school children, we have to formulate the yoga model in such a way that they will develop interest in that. So that will be the preventive. Then curative, as I told that let us combine all the patches and give the good result so that the PCOS can be controlled. And adjuvant, we can add all the, suppose if she is taking allopathic treatment, let her continue, but you can add the yogic treatment as adjuvant, and this will help to cure most of the PCOS, because as it is coming up, emerging a major problem in adolescent girls. So I hope with this, I will conclude that let us use yoga as a lifestyle, yogic style, and not only for just 1 hour or 30 minutes to be done, and also take the important this treatment modalities from other patches so that we can get good results. Thank you very much. And thanks all the three speakers. Also thanks the organizers, Dr. Rama Madam, for giving me opportunity to do the chairmanship and conclude it. Thank you very much, sir.
Dr. Ashok Vaidya would like to say a few words before we conclude this session.
Sir, you have to unmute yourself. We can't hear you.
At the outset, I congratulate all of you for an open mind to discuss a major pandemic in India. But I would like to make some corrections as a senior practitioner of yoga and also a scientist, as a clinical pharmacologist of almost 50 years standing. Satish and Ulka will be very happy to know that last 10 days I am with Swamiji, Swami Kobulayanandji. And I had the pleasure of his darshan also at Bombay. I visited Lonavala and Kaivalya Dham. I am paying a tribute to Kaivalya Dham in an article for JIM, because 1921 was the year actually when Kobulayanandji started the first research in yoga, scientific research. So it's a century. So this century we are celebrating today, not only for PCOS, we are celebrating, as rightly put by Satish, to incorporate in life. But at the same time, I would send a warning, because sometimes we get so enamored by yoga that we forget to be enamored by science. And particularly for Ulka, I would like to say, because she did mention the drawbacks of modern medicine. She mentioned that it wants to predict everything. Nothing is predictable. But we have not to stop at stress at hypothalamus. So I would like the group to know our work, particularly Vidita's work and our work on hippocampus, and how hippocampus is involved in chronic stress, and how hippocampal connection with prefrontal cortex and hippocampal connections with hypothalamus are involved in terms of vagal and sympathetic control. And as I'm reading the book written by no less than Tiwari ji and a group, is an amazing biography. I would recommend all of you to not study it. Please make it a Bible, because all the documentation excellently put. And I'm going to talk to Subodh ji also. What I would like to stress is, please appreciate the cutting edge of science. And I'm very sorry. I'm sorry because I've been involved in consciousness research. I've been involved in Kundalini research. I've been involved in Samadhi research. And I've also interacted with the masters of yoga, Siddha yogis. And I feel that the masters always warn me, don't get totally overwhelmed only by yoga, because research in science is also a yoga. And that's why I would end with the Gita shloka, Yukta Ahara Viharascha, Yukta Cheshtasya Karmashu, Yukta Bodha Sapnasya Yogo Bhavati Dukkha. In words, this center, the entire PCOS is covered. Ahar, Vihar, Yukta Cheshta is not only Cheshta external, it is not only Acharan, it is Ucharan, and also how your mind is thinking. And Swapnava Bodhasya, Yukta Swapna Bodha, sleep deprivation, Rama Vaidya, Shobha Madam have done a lot of work. So Nidhi, in your work also, I would like that all these factors contribute differently, and that's why you as well as Ulka has mentioned that how to individualize the patient. Because in our entire proceedings, we did not cover non-obese thin PCOS.
Somebody did mention.
It was just mentioned.
In a chat box, somebody has asked.
Yeah, in chat box also question is asked. Because sometimes we are not aware that everything is not psychosomatic. Genetic component is immense. Epigenetic component is even more immense than genetic component also. So I enjoyed it very much, and please thank you for giving me this time. But I will be very happy if Satish, Ulka, the inheritors of Swamiji, the inheritors of Dr. Vinekar, whom I had interacted with. I had interacted with Dr. Vaya and Dr. Vinekar, research going on at Lonavala, which I've always appreciated. So I would request that the scientific component of Kaivalyadham increases to a level where the molecular biologist and the molecular endocrinologist and molecular physiologist wake up again, because that was Swamiji's dream. Yes. Thank you very much.
Thank you very much, sir, for your precise message and inspiration for us to do some more research in this field. I will definitely take it ahead. Thank you, sir.
Thank you, Dr. Pathak and Dr. Neeta Dalal, for gracing this second session as a chairpersons. And we move on to vote of thanks now. And I would like to invite Dr. Anushri Patil for giving vote of thanks. Dr. Anushri Patil is a scientist at ICMR and IRRH-PDC, and she is a member of Mumbai Obstetrics and Gynecologist Society. I would like to invite Dr. Anushri Patil for a quick vote of thanks, please. Thank you.
Thank you, Dr. Vibhuti. It is indeed a privilege to give the vote of thanks at this international webinar on the Intersystem Dialogue to understand the perspective of yoga and naturopathy for the management of PCOS. It has indeed been an academic feast, and this will definitely also greatly contribute to the India-specific guidelines for the management of PCOS, which is being jointly developed by ICMR, NIRRH, and KIHS-MRF product development centers. This is indeed a great beginning, and I will like to express our heartfelt gratitude to all our faculty and participants. We thank our mentors, Dr. Ashok Vaidya sir and Dr. Rama Vaidya madam, for this very important initiative and for the excellent presentations. I thank all our esteemed chairpersons, Dr. Geeta Balsalkar madam, Dr. Ashish Phadke sir, Dr. Satish Pathak sir, Dr. Neeta Dalal madam, for chairing the sessions. We were indeed honored to have amongst us Dr. Ishwar Basavaraddi and Dr. Caroline E. Thank you, sir and madam, for sharing your valuable insights. We express our thanks to all the stalwarts in the field of yoga, Dr. Nidhi, Dr. Vibhuti, Dr. Ulka Nattu, for sharing their experiences. This has been a great teamwork, and we thank Dr. Shobha Udipi madam, Dr. Shobha Iyer, Dr. Shubhada, and everyone, and also Clarnet for organizing this international webinar. And this is definitely an important milestone for further research in the field of yoga and PCOS. Thank you, everyone.
Anu, can we see you? Everybody, please put their own video. We can take a picture. This is a unique opportunity. Please. Yeah, Shobha, Virja, Nutan, yeah, everybody. Somebody is taking this picture, please. Yeah. All the speakers are here. Vibhuti, there. Shubhada is there. Caroline had to go because it must be now late in the evening there. So we can, we must have taken another picture and we can put that. And so the great, Anu is there. Yeah, Ashwin is there, Jason Madam is there. Great.
Thank you. I've taken photographs.
Thanks. Thanks, everybody.
Thank you very much.
May I just say one, I just want to make one statement.
Please.
I want to place on record, I did not deserve that thanks at all, Dr. Patil. But I want to place on record my immense gratitude and appreciation for Dr. Rama Vaidya's vision and the immense toil that has gone into organizing these intersystem dialogues. This, and of course, sir's support is always there, but this is a stupendous effort. It's path-breaking for the entire country. And ma'am, my sincere pranams to you. We are so fortunate that you are our mentor. God bless you.
Thank you so much. Thank you so much. It always happens when we all are together. And I'm so happy that we all are together. And Neeta, I'm so glad because you had thought that it is on Wednesday, but Shubhada is an alert person of Shobha Iyer and others corrected that. So that was good. Very nice. Ulka, it was very nice to have you. And of course, Vibhuti and Nidhi. And Nidhi, in spite of her really recent problems, that she has been here. And I think we have to continue to be together. Yes. And that should be also time, without any time, so relaxed. And then somebody has asked that we want to see all the postures, this, that. So anybody from here who have been on chat, I'm sure that the organizers will look into that chat box and questions. And both Shubhada, Vibhuti, Shobha and Virja and Nutan Madam and others.
A statement from the group.
What sir is saying something, yeah.
Dr. Ishwar wanted a statement from the group for recommendation to the Yoga Council and Ayush also. Yeah. Dr. Rajesh Kotecha would be very happy. Even the Minister and Prime Minister would be very happy if such a group makes a recommendation.
Yeah. So we'll request Dr. Shobha Madam and our group under her leadership with Dr. Jayashree Joshi, Dr. Ashwini Kumar Raut, and Dr. Anushri, because they are looking into the, and I'm so glad that Dr. Nilima Kshirsagar on her own call this morning that I haven't received the link, and she remained present for quite some time. So that was very, very nice and was very good. Thanks, Anu. Thank you very much. Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Bye.
Thank you. Thank you. Thank you very much. Thank you.
And thanks
Thank you,
to who
madam.
has come today, Sonali, Sunaki, or who's there?
Shalini ma'am.
Shalini, yes, I want to see your face, Shalini.
Wonderful,
Please.
Shalini.
Wonderful. And tell Ishika, you people have always stood by. You know that platform that they are conducting, they don't allow anybody other than MBBS and MD. And we approach them and we say that you have always provided such a platform that you cannot deny. We are all together only. So they have been doing consistently. And so Clarinet, it was very, very nice that you have been with us and you've given grace time also. Thank you so much. Thank you so much.
Thank you.
Thank you so much.
Thank you. Thank you.
Thank you very much.
Thank
you.
very much.
Thank you.
Thank you.
Thank you.
Hmm?